Thanks so much for being here with me. I am going to get our slides set up. All right. So this is our topic for today. Of course, you all know that because you've signed up. Nutrition and the Cancer Treatment Toolbox. And we are specifically covering what to eat to manage side effects, specifically during treatment or even after treatment. Active treatment is over, some of those side effects persist. And there are some things that we can do to help manage those. So that's what we're going to cover today. This webinar is actually the last kind of in our fall series of webinars. And we came up with the topics. We surveyed cancer dietitian readers to find out what topics they wanted. So I think this was the third most voted on topic. So it certainly is something that's a little bit more specific to people who are in treatment, but hopefully you'll find this helpful either for yourself or somebody that you're helping to care for who is going through treatment. It is often challenging for patients because many patients don't actually have access to an oncology certified dietitian. So hopefully this information will get you kind of the basics and kind of get you started. But I also would hope that many of you, maybe if you are having some of these side effects, that you would be able to reach out and find a dietitian in your treatment center or where you live that could help if you need more than the tips that we cover tonight. So let's see. This is about me. So many of you already know me, but some of you may not. My name is Julie, and I am the Wellness Director at Cancer Services. So Cancer Services is a nonprofit agency in Winston-Salem, North Carolina. I have worked as the Wellness Director there for, okay, if I can do some quick math, 12 years. The website is now 13 years old. I completely missed the blogiversary, but the website's 13 years old. I started it just prior to coming to Cancer Services. And since being on staff at Cancer Services, we've incorporated the Cancer Dietitian website into all of our programs, which has been really great for me because I can offer these programs available to you at no charge because of the support that we have for our agency. So that's to say that you can thank Cancer Services for that and all the supporters that we have. And that way our programs and the website is available to you at no charge. I am a registered dietitian nutritionist, which means that I have a 4-year degree in nutrition. I did that at NC State University, and also I did some nutrition and dietetics training at the University of Arizona. And then I did my master's in public health at UNC Chapel Hill, which is where I also did my internship. So I actually have an intern right now, intern Courtney, for those of you who've been involved in some programs this fall, you'll know that. And she is doing her MPH at UNC Chapel Hill as well. So with that program, there's a built-in internship. All dietitians have to go through not just accredited degree programs, but we also have to do a supervised internship and pass an exam. And then to be a board certified specialist in oncology nutrition, I have to have practice hours working in oncology and then take an exam every 5 years to prove that I'm current. And the exam is not easy, I will say that. And a lot of the stuff that kind of we'll cover today is sort of scratches the surface of what we have to know as board certified specialists in oncology nutrition. And really there's a lot of kind of detailed information about medications that we will not go into today around cancer. So that's to say, if you are in Winston-Salem and you get treated at one of our cancer centers, there are oncology dietitians at both centers available to you. And for those of you who are not in the local area where I am, there are often oncology certified dietitians at the cancer centers, either where you're treated or at some of the larger centers that may be near you. So that's a plug to try to find one. So these are our goals for the session today. We're going to discuss the role of nutrition during treatment. We're going to talk about general nutrition tips for during treatment, kind of things to look out for, the high level things. And then we're going to cover some of the common nutrition related side effects, how to figure out how to stay nourished within those challenges. And then we'll talk about nutritional signs to monitor. So there's actually a lot of slides this time, and there's a lot of information on the slides. So you don't have to worry about it. I will post this on my website tomorrow. I will make sure that the slides are available for you to download, and also that you can rewatch this if you need to, if you want to send it to a friend. So bottom line, when it comes to nutrition during treatment, the challenge is that all treatments have different side effects, and it really depends on the person, the type of cancer, the stage of cancer, what type of treatment you're getting, as to what the side effects might be. And that means that there's no sort of one size fits all nutrition answer for people, especially during treatment. Actually, what I would say is for people who are completed with active treatment and kind of able to eat pretty regularly, it's a little bit broader of a recommendation for nutrition. But when we're talking about nutrition during treatment, the strategies that we use are actually pretty tailored to your individual situation. And what we as oncology dietitians have found is that sometimes it can be overwhelming to sort of introduce the idea of all these tools that we have in our toolbox at the beginning of your treatment. And rather, we just encourage you to kind of pay attention to what your body is, how your body's doing and what challenges you're having. And we'll pull these tools out of the toolbox as challenges present themselves. But really understanding the role of nutrition during treatment also helps you understand how it can help. So for those of you who've attended some of my other webinars, this will be familiar with you. The role of nutrition during treatment is to repair and maintain all the cells of the body. So treatment is there to target the tumor, and that's what we want. We want those targeted therapies. We want you, if you've heard precision medicine, that means kind of typing your particular type of cancer and then matching a treatment that will treat it very effectively. And so it's very targeted. And the goal is to essentially eliminate that tumor wherever it is. Now, when it comes to nutrition, nutrition's not a treatment for cancer. It's not going to get rid of a tumor. However, it will support all the rest of your body. And you obviously can't go about life if you're not able to support and nourish your whole body. So the role of nutrition is to work on all the cells of your body while your treatments target the tumor. If you are or become malnourished, there's a lot of effects that can have on your body. It can reduce your immune response. It can contribute to fatigue. It can lower your muscle strength. It affects your ability to tolerate treatment. We'll talk about that in just a minute. Certainly can lower your quality of life and has some effects on your psychosocial functioning, especially if it's someone who can't enjoy meal times. Meal times are usually a time and place where you connect with your social circles. And then it can affect wound healing. So especially people who maybe have had to have a surgery, even simple things where you've had something placed, a port placed, or maybe you've had to have a feeding tube placed, you still have to heal up from those surgeries. And if you are malnourished, it makes it that much harder. So that's where nutrition can really play a role, is first of all, to maintain good nutrition status, sort of prevent malnutrition, or treat it if it has happened. Good nutrition during treatment can help lessen side effects. So you'll feel less fatigued if you're well nourished than if you're not well nourished. It supports your immune system. Your immune system will be more effective at protecting your body if it's well nourished. It helps maintain weight, which is kind of just one of those signs that you're well nourished, and it can help keep you energized. However, it cannot cure cancer. And some people will actually email me, or I've had phone calls where people, that call and they say, well, I want to know what I can do. I don't really feel like taking treatment because there's all these side effects and it can be toxic. And I want to heal quote, cure my cancer naturally with diet. And I'm pretty honest with those people that's not the role of nutrition, and we don't have evidence that it can cure cancer. However, it's really important to maintain good nutrition status in order to have the best outcomes from your treatment. All right, so let's talk about malnutrition and what I call the cycle of malnutrition, or the cycle of inadequate nutrition. What typically happens is that someone is not able to eat enough, because our only way of nourishing our bodies is by actually consuming food. Either by mouth, or if somebody has a feeding tube, you would use the tube to do that. But if someone is unable to get enough food and their calorie and protein needs aren't met, then their body is forced to pull on their energy stores. So your energy stores are generally fat and muscle stores. We don't really want you to pull from those energy stores, especially during treatment, because we want those to be available for, in the worst case scenario where you're not able to eat. So whenever possible, we're trying to meet your calorie and protein needs. Now, for some people, they are actually not getting enough calories and protein sort of leading up to their diagnosis. For some people, weight loss itself is one of the signs that something isn't quite right, and they've gone to the doctor and they say, I'm losing weight, I'm not really sure why, and then the doctor starts doing diagnostic tests, and they might find out then that they have cancer. And in that case, they're already kind of starting a little bit behind from a nourishment standpoint, because their body has already started to pull on energy stores. And that's one of our biggest signs, is weight loss. So if your body is pulling on your muscle and fat stores in order to maintain their nutrition, then what we see is you will see numbers on the scale that are going down, and you will also feel more weak and tired. You'll be fatigued, and your immune function just isn't quite as strong. And then sometimes when that happens, you feel so awful, or your immune system is so weakened, some of your counts get really low, that your body is not strong enough to tolerate treatment. And then if you have to skip treatments or miss treatments, then we believe that treatment is less effective. So oftentimes your medical team, your oncologist, everybody who's kind of looking at your case and trying to figure out what is the best treatment for you, they have a treatment regimen that has sort of been proven maybe for your particular type of cancer, and they don't want you to miss treatments. So one of the things that as oncology dietitians, kind of our measures in terms of success are, do people have to miss treatment, or can we keep them on their treatment regimen? So this is what I would call, not the worst case scenario, but this is kind of the cycle that we want to avoid when we're talking about malnutrition. In many cancer centers, they will use a malnutrition screening tool to try to, catch people early on if it looks like they're either at high risk or are already in the early phases of malnutrition, to try to intervene sooner rather than later. But in a lot of places, it can get missed if you as a patient don't speak up for yourself. So I'm always encouraging my patients that if you notice your weight has dropped or continuously is dropping from one visit to the next, and your treatment team is not bringing it up, you need to be the one that brings it up and ask if there's something that you need to do, or ask if you can see the dietitian or be assessed for malnutrition. So then this would be our cycle that we prefer, that we would meet nutrition needs so that your calories and protein needs are met. That will help at least maintain or maybe even build some energy stores, so your body's able to add to the stores, meet your needs, and then put a little bit away for when you might need it. Your weight is probably very stable. Your immune system and energy levels are as good as they're going to be. I never make guarantees when it comes to energy levels, especially during treatment. But if you are well nourished, adequately nourished, getting your nutrition needs, you're certainly going to have more energy than if you weren't. And the same thing when we talk about nutrition, it is calories and protein, but it's also fluid needs. So making sure you're hydrated. if you're in that place, your treatments are likely going to be tolerable. Your blood counts are going to be as strong as they can be given the treatments that you're having, and you will likely not have to miss any treatments, which will ensure your best chances at good outcomes. I sometimes will have people, contact me and say, well, my counts were low. What can I eat to boost my blood counts? As if there's any particular foods. For whatever reason, if they want to boost their blood counts, they want to eat beets. And I don't know if it has something to do with the red color. There's not data behind that. What I often tell people is there's no specific foods. It really is mostly going to be keyed in on, are you adequately nourished? Are you getting enough calories and protein and a variety of foods that meets your nutrition needs? That's what's going to help keep your counts up. So this is our ideal cycle. If somebody, really, if you're malnourished or if you're at risk for malnutrition, our intervention is right here at the front end at meet nutrition needs. It doesn't have to be that your nutrition needs are met with this like super healthy, some of the other webinars I've done about plant-based eating for cancer survivors and having this perfectly proportioned, plate of foods that have the right combo of this and that. A lot of times, and you'll find that as I go through tonight's webinar, meeting your nutrition needs can be even more basic than that. It's really just what kind of troubleshooting can we do? What kind of tools can we pull out of our toolbox that meet your basic calorie and protein needs? And that's why oncology dietitians, I say that we have a lot of freedom in the foods that we can help you get to meet your nutrition needs, as opposed to somebody who's working in like cardiac rehab, where they're all trying to really key people into a really healthy diet after, they've had a heart attack or whatever. During cancer treatment, we are keyed in on getting enough calories and protein. And then if you can meet those needs pretty easily, that's when we start building on, okay, let's focus on the quality of your foods. But really our baseline focus, especially during treatment, is to meet those needs however we can. And so we'll talk about those things. So these are our overall top 5 tips for cancer treatment, managing side effects. So these are our 5 cancer nutrition treatment guidelines to live by. So we tried to boil it down. You'll see in some of the slides later on that there's some key things, and these are the key things that we need you to remember. First of all, avoid malnutrition if at all possible. So early intervention, if you notice that you are losing weight or you're not feeling like you have enough energy. Number 2, eat what you can when you can. So we are not picky. We're not going to be super picky about how healthy your foods are. We want you to get enough calories and protein, and that means eating what you can when you can. Focus on fluids. Make sure you're getting plenty of fluids throughout the day. Grazing can be a great way. Small, frequent meals is a common recommendation we make so that you're not feeling overwhelmed at meal times like you have to eat a lot at a time. And then get help and support. That is key, very key to this. And a lot of people want to help you. They want to bring you food. So especially in that number 5 bullet point, helping them understand what are the foods that can really help you. And they'll be there for you. They'll drop groceries off at your door. They'll bring you meals, whatever it is. You just have to guide them. So first of all, avoiding malnutrition. The number 1 goal is that you get adequate nutrients and calories during treatment to avoid malnutrition. Typically, our biggest sign for that is weight and muscle loss. So you can usually tell that, of course, by the scale, but also if you notice that you feel weaker, you just don't feel as strong as you used to, or your clothes fit differently. Maybe you're the same weight, but your clothes fit differently. That typically means that you've lost muscle. And that can, be a sign of malnutrition. We want your muscle mass to stay as strong as possible during treatment. And things like bed rest, surgeries, you can lose muscle mass pretty fast. So those are things you want to watch out for. Number 2, eat what you can when you can. So whatever foods sound good to you, we are not picky on this. You can eat more healthy, things on the days when you feel well. But when you're not feeling well, and probably your oncologists have told you, we don't care if you eat milkshakes. We don't care if you eat, they always like to use peanut butter. I have patients sometimes that are like, I'm so tired of peanut butter. But peanut butter is a great food. Really, anything that sounds good to you, we often tell you ice cream, pies, whatever sounds good to you. If you're having one of those days, we need you to be nourished. So you need to eat something rather than nothing. And then eating foods that sound good and appetizing about every 2 to 3 hours will key in on our grazing tip. Focus on fluids. So aim for 64 ounces a day. All fluids count. So another way you can optimize calorie intake is to have your fluids also include calories. So things like juice, lemonade, sports drinks, some nutrition supplement drinks can help to meet your fluid needs and also add extra calories. Now, there are certain chemos where you will need to drink extra water to kind of flush out your kidneys, and your nurses usually tell you that. So that would be on top of the 64 ounces. And then it's especially true if you are dealing with diarrhea or a lot of vomiting, that you'll be more likely to be dehydrated. And so you need to replenish those fluids. So you may need even more. And then the other thing I would focus on this is if you're not eating anything at all, I would really encourage you to have your fluids be something like Pedialyte or Gatorade, where you're rehydrating with those electrolytes. If you're really not able to eat at all, you're going to need those electrolytes to help, especially if you're having diarrhea and vomiting and you're not able to eat. Getting electrolyte fluids is really key. Graze throughout the day. So this is small, frequent, nutrient-dense meals throughout the day. Basically, this means eat something every 2 to 3 hours. True for liquids and foods, like I already mentioned the different liquids. What I often tell people in this case is to eat something within an hour of waking up in the morning. So if you have medication you have to take in the morning on an empty stomach, take it as soon as you get up. And then when it's been an hour, then you can eat. And so that's when you would eat your first meal. I don't like people to wait a long time after they get up in the morning, because then they miss that opportunity. So we want to go ahead, have something to eat within an hour, and then have something every 2 to 3 hours throughout the day. This is a good role that a caregiver can play, is to set a timer or just remind you when it's been 2 or 3 hours since you ate last. Number 5 on our list is to get help. So that means that you want to key in on how people can help you. So you want to make sure that you have built your team, your support team. Don't wait until it's a crisis to build your team. Go ahead and get your team built from the beginning, and then you know who to call for different issues. So have your friends, your family, your medical team, social services, whatever it is that you are going to need around you, especially if you're somebody who is, lives either alone or you don't have someone to care for you during your treatments. If you are reliant on your job for your income and you have to take time off work, you're going to need to get that support system in place. So at Cancer Services, where I work, we have a whole patient advocate team. We do financial assistance. We have all kinds of experts that can help connect people. And we always tell our patients and the hospitals that people need to get to us sooner rather than later. So building that team early on, and especially when people say, well, how can I help? Be ready to give them things to do. So if you're somebody where finances are really going to be tight, and you think that there might be some challenges just getting enough food in your pantry, then let people know, hey, I'm going to need food. My budget's going to be really tight. I have to prioritize my medication. Can you help with, getting me toilet paper or stocking my pantry for a couple of months while I get through this? It might be that you need to tell them exactly what works for you. So as if you face nutritional challenges, and they bring you food that you just can't eat, that's not particularly helpful. So you'll have to stay in communication and tell them what you need. And then let people help you. That's what I always say. So identify someone to support you during treatment days, which will include kind of making sure that you're getting nutrition during the day, the day of treatment and a couple days after especially. All right, so what are the most common nutrition-related side effects that people face? And this is not an evidence-based list. This is just Julie's experience. So I worked as an outpatient oncology dietitian for 2 years before coming to Cancer Services. So at Cancer Services, I'm not working as regularly with people during treatment because their treatment center dietitians can really help them, but I often have people emailing me. So I still kind of have a pretty good feel as to what the most common side effects are. So these are, we'll call our top 8. So poor appetite is a big one. Unintentional weight loss, fatigue, constipation, of course, the opposite as well, diarrhea, nausea and vomiting, taste and smell changes, sore throat and mouth. And I'll tell you, the funny thing is, in school, we learn about all different types of diseases and how nutrition can help people through those. And what they taught us in the cancer section was nausea and vomiting and taste and smell changes were like the biggest thing. And then when I started working in oncology, I actually found they weren't quite as common as maybe I had been taught. But the other thing is, in all of this, there are often medications that can either help alleviate some of these things or actually cause them to be worse. And so especially with nausea and vomiting, using medication, which we'll talk about when we get to that section, has really helped to make it so that it's a lot more manageable. So let's start with number 1, poor appetite. And we talked about that adequate nutrition is really needed for cancer recovery and preventing of that sort of using of your stores or muscle wasting. And so the tips for poor appetite, number 1 is that grazing. So having something to eat, small meals every 2 to 3 hours. Exercise actually helps to stimulate your appetite. So making sure that you're getting exercise, and exercise is kind of a tough word. People hear that and they think that they have to go for a run or something, but we're just talking about being physically active, getting up off the couch or getting up out of bed, moving around in a way that will basically signal to your body that it needs nourishment, and that helps to stimulate your appetite. You can add supplemental nutrition to foods. So that can be using products that might boost some of the nutritional value. It could be using dry milk powder and adding that into milk or smoothies that adds extra protein. You can also buy commercial products. I'm going to be doing a webinar on December 2nd. It's a Wednesday at 2:00 where I'm going to highlight some products that actually can help with that. So keep an eye out for that. Pre-make nutrient-dense snacks to keep on hand. So I'll talk a little bit about what those would be. And then make sure you're just keeping an eye. So if you notice that you have less appetite, you don't want to wait and find out, a month later that you've lost 20 pounds. As a result of that, you want to make sure that you're keeping an eye on your weight, how your body feels in terms of strength. And then also if you're getting regular lab work, which is the nice thing about working in oncology is that most of my patients are getting regular lab work. You can just ask your doctor to make sure, do my nutrient levels look okay? And then make mealtime fun, relaxing, and not stressful. And that's really more of a tip for the caregiver. Sometimes I find that caregivers they're so overly concerned about nutrition and getting their loved one to eat enough that they make mealtime so stressful that like everybody is kind of anxious at the dinner table. It makes it hard to relax and eat and enjoy things when you're in that place. So some nutrient-dense foods that you can think about for poor appetite: stock your pantry, ask your friends to stock your pantry. Avocados are great sources of fat. They're also heart-healthy fats, so you get a little bonus there. Dried fruits, raisins, dried apricots, dried cranberries, nuts, seeds, and nut butters. Bean dips or spreads. Actually, this week at one of my local grocery stores, it's called dessert hummus. Chocolate hummus was on sale. And so we've been enjoying that this week. And so it's a bean dip, but it's got some chocolate and sweetened, and it's a great dip for like crackers, or we use pretzels. Whole grain crackers with cheese, fruit dipped in peanut butter, high calorie cereals, oatmeal, granola, or whole grain options. And I have a granola recipe. You could tell somebody to make you some of that granola. Healthy oils such as olive and canola oil to add to your stir fries, or you can even just add them to things like soups to give you an extra boost of calories. 100% fruit juice, and then nutritional supplement drinks. So there's a variety of those. You can get store brands, you can get Ensure or Boost or some of the specialty Gain is one that I've seen sold at Costco. You can get either the dry mixes and mix it up yourself, or you can buy them pre-mixed in the packages. And there are some, Nestle has a product that's like it's even more calories than the traditional Boost. I can't remember the name of it. I'll have to figure that out, but it's like 2.25 or some really high number in terms of the calories per ounce. And so there are ways that you can just kind of have those throughout the day. Weight loss, which is usually kind of a secondary to poor appetite, but sometimes people have what they think is a normal appetite, and they find that they're losing weight because either the cancer itself or the treatments that you're having actually cause your body to have a higher metabolic state. And so you don't realize that your body actually needs more food than you're taking in. And so that might show up on the scale. So this can lead to muscle and body wasting. And the tips for that is really to not fill up right at mealtime with fluids. So to eat your foods separate from your fluids and then have your fluids after you eat. And then some of the same tips as we have just covered for poor appetite. I'll also mention that for in some cases, if you're doing these nutrition tips and you're not able to meet your nutrition needs, or you're full all the time, we call it early satiety. If you just eat a little bit of food and you fill up really fast, there are medications that can help either empty your stomach quicker or to actually increase your appetite. So if people have, heard about using medical marijuana to help increase your appetite, some states that's legal, some states it's not, but they actually have pills that increase your appetite. So you don't have to use the medical marijuana if you don't want to. You can use some of the prescription medications that are built to help increase your appetite. So that's something that you might want to keep in mind or be in conversation with your doctor about. The other thing I'll point out with weight loss is that some people actually gain weight during treatment. Usually it's more people with breast cancer oftentimes will gain weight during treatment. So it is something to keep an eye on and to know what is kind of normal for you. So here are some foods to encourage weight gain. Adding nutritional shakes to your favorite foods. There is this is my chocolate banana smoothie recipe. So some of you who've done my other cooking classes or webinars may be familiar with this because it's my very favorite thing to make, especially when I was going out, back in the day when we got to do real live groups. I would do taste testing with this particular recipe. But with this smoothie and any smoothie recipe, if you're trying to build in more calories and protein into the recipes instead of just using plain milk, for sure you would want to use whole milk or the kind of, I can't remember what they call it, but fortified milk, where it's whole milk with extra protein added. Or you can use something like Boost or Ensure or store brand of whatever nutritional supplement drink that you have available in place of the milk. So if it calls for a cup of milk, you would use 8 ounces of that nutrition supplement drink. And I've made these, I have recipes on some recipe videos they're probably 5 years old, but they're still good, on my YouTube channel that has things that you can make with nutrition supplement drink, so that you don't have to drink the same flavor over and over and over again. You can add some additional nutrients with the smoothie ingredients, but also help change the flavor. So you can find more tips on cancerdietitian.com/tips, which is where I'll also end up placing this webinar and some of the things that we're talking about. So fatigue is really very common from all types of different cancer diagnoses and in treatment. It's often due to either cancer itself, the treatments, the stress, the emotional strain that it takes to, face a diagnosis and go through treatment and manage everything. It can be from diarrhea or the dehydration from the diarrhea. It can be from infection. You could have low iron, which causes anemia. So all of these things contribute to fatigue. And for some people, it's many different factors that are playing into their fatigue. So Actually, the current evidence-based recommendation for helping to fight fatigue is to be getting physical activity. So our tip is to exercise when you have the most energy. For a lot of people, that's first thing in the morning. Get up, move your body, move around. It helps, first of all, we talked about stimulate your appetite, but it also can help to combat this fatigue. So other tips so that you can focus your energy on the things you really want to do, like probably, getting some physical activity. You may not want to use your energy preparing meals. So that means have ready to go meals, especially prepared for treatment days, asking your friends and family who have said, we want to help. Hey, you know what? Can they get some stuff to stock your freezer or your fridge so that you don't have to spend a lot of energy cooking? Get easy to chew foods. Sometimes chewing itself is just too much effort. So things like smoothies, milkshakes, soft foods, soups, those are things that I find people can tolerate better. Eat a larger meal when your appetite is at your highest. So sometimes, again, that's first thing in the morning. Maybe breakfast is going to be your biggest meal of the day. And then talk to your medical team if you need a physical therapist or other nutritional assessment. So if your fatigue is really affecting your quality of life to a point where you're really not able to function very well or enjoy the time that you've got available to you, I would suggest bringing that up with your medical team. And it may be that if you've gone through a surgery and you've had a lot of muscle wasting, it's difficult to build that muscle back up, and you may need a physical therapist or an exercise physiologist to help you with that. And then of course your accessing an oncology dietitian can also help. So these are some of our favorite easy to eat foods: pretzels, nuts. If crunching on things is too much energy, then get the nut butter version of it. Grapes, trail mix, applesauce cups that are ready to go, popcorn. I buy popcorn in this big bag from Costco because sometimes you just don't have time to stick it in the microwave. You just want to eat. Banana, string cheese, granola bars, buying the cheese already sliced and ready for you to eat, yogurt and granola, graham crackers with almond butter, delicious. Hummus and veggies, or get the chocolate hummus with pretzels, whole grain muffins, rice cake and peanut butter, hard-boiled eggs. These are all things you can even buy hard-boiled eggs already boiled for you, right? Those are things that you can keep around so that it's easy to grab and you can meet those nutrition needs. All right, so our next one is constipation. And so this it can be a problem either because you've had a surgery that affects your GI tract. It could be a problem because you're having treatment, say radiation to your GI tract. But for a lot of people, it's a result of pain medicine. So you've had surgery or your cancer is causing some pain in your body. And so you're managing that pain with pain medicines, opioids. But they, the way they function to sort of numb your nerves, it also slows down your GI tract. And so your GI tract, which is just your colon and your intestines, they kind of, on their own, they're constantly like moving. We call it, our clinical term is peristalsis. So your cells of your intestines are just kind of like massaging the food through, and your body is kind of picking apart the nutrients it needs. And then you form a stool in your lower intestine and in your colon, and your body naturally just sort of moves it along. And we all kind of have a regular pattern that we usually follow for our bowel movements. And what happens is when you're taking those pain medicines, if it's numbing these and slows down your GI tract, it means the bowels are not moving as much. And so the stool can sometimes sort of just stay there longer. And then your body starts pulling more fluids out of it, which makes it a harder, smaller stool. And then it just sort of stays there longer. And the longer it's in there, the more it becomes difficult to move. And so this is what happens a lot of times for people who, especially when you first start the pain medicine, if you haven't paid attention, sometimes then all of a sudden one day you're like, oh my gosh, how long has it been since I had a bowel movement? What is happening? And then you get all worried and stressed out about it. And that can also make it worse. So for a lot of people who, the standard of practice really is if you are prescribed pain medicine, that you would be given a bowel management regimen. So that is something that I encourage you to ask about. Now, if you've been on the pain medicine or you haven't had too many issues, then what we really want to pay attention to is how often are you having bowel movements? Is it about regular for you? And I've done a kind of a little education session on what's normal on my website. But for, what we say is normal is anywhere from 3 times a day to once every 3 days. So if the medical definition of constipation is if you have a bowel movement 1 or 2 times a week. So that means that it's going on, longer than 3 days. And or you have difficulty, either you have to strain to have a bowel movement or it's painful. Those are our definitions of constipation. So the tips for that is eat at regular times every day. So have some sort of routine for eating, because that means that your body will likely have a routine for eliminating waste. Increasing your fluids, getting plenty of fluids, being active again, regular physical activity will help your body to move your bowels. Increasing fiber intake whenever possible. This is challenging because sometimes the foods that you tolerate are the bland, low fiber foods. And so that's something that sometimes we have to tweak. And then avoid gassy or bloaty causing foods, because if your stools are slow in your intestines, then that can make it even worse. And then if those tips don't work for you, or you're going several days without a bowel movement, you need to get some intervention going. And with the bowel management regimen, a lot of times they might give you laxatives that you take regularly. So you get kind of on a routine to try to start having a regular bowel movement. So there's a lot of things that we can do with this. My biggest tip to you is to not wait too long to let your team know if you're having issues. So know when you should be calling them. There are medications to assist. We talked about that. I have found that if you do need to add fiber to your diet and you want to use either psyllium husk fiber, I have found that things like benefiber don't actually help much at all. You need the bulk forming fiber. But if your constipation is a result of pain medicine, adding fiber sometimes can make it worse. So what I say is it's like adding cement into the mixer is not necessarily going to push anything out. So you don't want to add more in terms of fiber unless we know that we've got things under control. So for sure, contact your medical team. So 25 to 35 grams of fiber per day is what we would be aiming for, assuming you're not having issues getting in fiber. And then 8 cups of fluids or more. Hot beverages and hot food consumption can help stimulate the bowels. Possibly you may need a probiotic. That's something to ask your medical team about. Physical therapy. Sometimes if you have had a surgery in your abdominal region, then your organs maybe are sort of reorganized. Your bowel and where your intestines come out through your anus to release your bowel movements, it can be reorganized or in a different position. And so sometimes physical therapy can actually help you by helping you to have the right strategy when you are having your bowel movement, or to encourage better bowel movements. So that's something I think a lot of people aren't aware of. Make bathroom times relaxing and not stressful. Sounds like I was talking about meal times, but we can all of a sudden get like really anxious about bowel movements, and that can make it worse. Fiber supplement, if your medical team thinks that would be helpful, and for sure be in touch with them. So it is a big issue for people. Foods that can help: water, prune juice, especially if you want to do some hot prune juice, warm other juices, decaffeinated teas, hot lemonade, smoothies can often give you extra fiber. And then lots of high fiber vegetables, of course, beans, whole grain breads, and foods which are liquids at room temperature, popsicles, things that can just help you get more fluids in. All right. So for the opposite problem, right, is diarrhea. This can be caused by medications. It could be GI upset. I have had radiation as a big cause for people of diarrhea, people who have like ovarian cancer or endometrial cancer or GI cancer or prostate cancer, where you are getting radiation to your abdominal region. If your intestines are in the radiation fields, it can kill some of the cells of your intestines. They're quick turnover. That means that you grow new intestinal cells pretty quickly. However, when they are affected by the radiation, it can just mean that they don't digest and absorb your nutrients very well. And that means the food kind of just moves right on through. And when your food moves right on through, undigested, basically, it tends to pull a lot of fluid with it. And when it pulls fluid with it, then you have these really loose stools that are hard to control. And that's what leaves you with having multiple bowel movements a day that are very liquidy. So tips for that is that you would have small, frequent meals, decrease fat and fiber consumption if they tend to cause more issues. So sometimes fat is hard to digest and absorb, and so it will go right through, and that can cause more diarrhea. Avoid caffeine and alcohol for whatever reason. Those seem to be difficult to digest. Avoid gas-producing foods like beans or cruciferous vegetables like broccoli. Consider soluble fiber foods like oatmeal. I know it sounds kind of crazy. Why would I add fiber if I have diarrhea? But soluble fiber means that it absorbs liquid. And so sometimes that actually helps kind of absorb the liquid in the intestines and form more of a solid stool. And then you want to avoid sugar alcohols, Trident gum, or other sort of diet foods or low sugar foods where they might be using a sugar alcohol that can also contribute to excess water. And then if you have diarrhea that persists for more than a day, you need to contact your medical team. You may need medical management in terms of things like Imodium. You might just need to be on a regular, regimen of Imodium throughout your treatments to help manage this. And I do know people who've had to do that, and it has worked and been helpful for them. Foods that can soothe diarrhea. So I don't know if you've heard of the brat diet, but I'm actually not sure. So I've people talk about this a lot. Doctors like to use it, but I don't think there's a lot of really strong evidence, but I think it's kind of a common sense thing. It's like, what are some very bland foods that you can eat that will nourish you, but won't cause upset? And so bananas are pretty bland. When we say rice, we pretty much mean white rice. Applesauce doesn't upset your stomach because they've, removed the skin, which is kind of the insoluble fiber part of the apple. And then they've cooked it, which helps make it easy to digest. And then toast. So something like white toast would be another really easy to digest food. Noodles, I would say the noodles that are not whole grain noodles, so enriched white noodles, well-cooked eggs, pureed vegetables. And the reason for that is when you cook foods, it helps to make digestion easier. When you puree them, it makes it easier to digest. It's like it's doing some of the digestive work for your body. So when you consume them already cooked and pureed, it just means that it's that much easier for your body to kind of break it into the pieces that it wants to digest and absorb. White bread, skinned turkey or chicken, because the skin has more fat in it, which is harder to digest and absorb. Fish, mashed potatoes with the skins removed. Yogurt and kefir, because of the probiotics, can be helpful. So there's some tips on that. Nausea and vomiting, which I told you was supposed to be the most common problem, but is pretty well or better managed now than it used to be. It can be a problem if it's ongoing, because you can learn electrolytes, like I mentioned before. Now, you can get plenty of electrolytes if you're able to eat and drink foods throughout the day. You'll be able to meet those needs. But if you are having so much nausea and vomiting that you're not able to eat at all, that's when I mentioned you want to use like Pedialyte or Gatorade or some kind of electrolyte beverage to make sure you're replenishing those. So we talked about some of those easy to digest foods, avoiding high fat foods, limit exposure to strong food smells. So from a nausea standpoint, The example I always use is we don't suggest you use the microwave because you heat up the foods, you open the microwave door, and you just get this woof of smell. And the same thing if you're cooking something in a pot and you pick the lid up. When you get that whiff, oftentimes that is kind of what puts you over in terms of like, oh, I can't eat anything. So that's why we say to eat cool foods, because you don't have to have that smell of the food as much. Elevate your head after eating. That helps to just make sure that gravity helps move things down. The other thing I would tell you, if you're using things like nutrition supplement drinks like Boost or Ensure, sometimes the smell of those is what can make people feel not so well. So I always have people put a lid. So put it in like a coffee mug that has a lid, and you can put a straw in it. And that way you don't have to smell it. You can just drink it. And then the most important thing that you need to do in this case is to take your anti-nausea medicine 30 minutes before you eat. So the biggest mistake I find is that people kind of pride themselves on not having to take medicine. And then what they do is they're like, well, I'll just take my nausea medicine if I need it. And then they wait until they sit down to eat. And then they sit down to eat and they sit in front of their plate. And all of a sudden they're like, well, I don't feel so good. Then they're like, well, maybe I should take my nausea medicine. They take their nausea medicine. It takes 30 minutes for it to kick in. By then they're like, oh, I just don't feel well at all. And they don't eat. So what I want you to do is to make a point. If nausea is a problem, it's preventing you from eating or eating enough to meet your nutrient needs, you have got to take that nausea medicine 30 minutes before you sit down to eat and get on some kind of schedule. So if you're on a 12-hour nausea medicine, take it 30 minutes before you eat breakfast, and then take it again, maybe 30 minutes before you eat dinner, so that it's kicked in and it's working by the time you arrive at the table where the food's in front of you. You need it to be kind of right there on par working for you. Ginger can be something that helps people with nausea. So you can either get my favorite place for crystallized ginger is actually Trader Joe's. It's they have kind of pieces of it rather than the super expensive crystallized ginger in the spices section of your regular grocery store. I mean, those things are hard as rocks, but the kind at Trader Joe's is more like a candied kind of dried fruit that you can chew on. And you can also make ginger tea. So this is a honey lemon ginger tea. You take 4 cups of water and then 2 lemons juiced and zest, 3 tablespoons of honey, put ginger root in the pot, boil it. Oh, we missed for part of this. I would say, I don't know, probably 15-20 minutes. And then you can strain it out and you can keep those 4 cups. You can put it in the fridge, reheat it later, eat it at that point. It's just a really great kind of soothing thing for your stomach. Taste and smell changes. So I mentioned before that your GI tract has these cells that kind of turn over a lot, which means that they regrow new cells every 3 days or so. And so what happens with especially chemos, the reason you lose your hair is that hair follicles, hair cells are actually, they turn over pretty quick too. Like, my hair like a year ago was a lot shorter and now look how long it is. The cells of your mouth, your esophagus, your stomach, your intestines, they can kind of regrow every 3 days, which means that they turn over quickly, which means chemo can affect them. And so it can kill your taste buds. It can cause, GI upset, all those types of things. So with your taste buds changing, there's not a whole lot we can do to fix that. We just try to figure out how can we find foods that do taste good to you given the taste changes. So one thing is actually to just rinse your mouth before you eat. It helps to clear your palate. So a baking soda saltwater solution or brushing your teeth. I have a hard time brushing my teeth before I eat. Now I'm not in chemo, so it might be different for somebody in chemo, but the toothpaste taste just kind of takes away from the taste of the food I'm eating. So it might help you in this case, but it might not. The baking soda and saltwater solution is something that can help clear the palate. And we don't recommend using alcohol-based mouthwashes, especially if you have dry mouth or taste changes. So this, I think we have the recipe here, the oral hygiene rinse recipe, which is 3/4 of a teaspoon of salt, 1 teaspoon of baking soda and 4 cups of water is something you can use to rinse your mouth. The other thing you can do to clear your palate is squeeze some lemon and water. You can drink that with your meal, or you can drink it beforehand to help clear your palate out. And some people really find that that's helpful. So different people have different taste changes, which also makes this hard for me to, kind of give you the overall recommendation. But if you find that nothing tastes at all, so this probably is also effective for people who've gone through COVID, where your taste and your smell, you kind of lose that, and all of a sudden, like, nothing tastes very good anymore. You want to add seasonings to it. So stronger flavors will help, hopefully, like, get your taste buds attention. So cinnamon, herbs, pepper, anything that kind of has a stronger flavor that you can add in. If you tolerate it, spicy foods will help with that. If you have an off taste or something just doesn't taste right, that's where the lemon can help. Bitter or metallic taste is pretty common. So you want to stay away from the metal silverware, because it can just leave an extra taste in your mouth. And then for salty or bitter foods, try sweeter. Marinades sometimes can help, especially if meats are tasting bitter. Sweet marinades, I think about things like teriyaki sauce, or some kind, even barbecue sauce is very sweet. Or choose a different type of protein source. If smells bother you, we mentioned using cool foods. I cup with the lid. I promise it works. And then if you are having pain in your mouth, there are some sprays, rinses, gels that you can use before you eat that numbs your mouth, so that then you can tolerate it. And that's what really can help with sore throat and mouth. Avoid any citrusy, really spicy foods, things that will make if you think about, if you've ever burned your mouth on something hot for like a day, you can't tolerate anything that's even a little bit sensitive in your mouth. And that's what we're really looking at here. So finding bland or cold foods are soothing. Nestle actually has a new product called Boost Soothe, which I've written about, and there's a little advertisement on my website that Nestle is sponsoring. And Boost Soothe is a clear liquid that has, I think, like 300 calories per packet or box and 10 grams of protein. And it's designed to have this soothing feel. So it's kind of it's an alternative to a supplement drink that doesn't have a lot of added nutrients to it, because those sometimes can have an odd taste to people, but it has a minty flavor that's supposed to be soothing. So that's an option if you're not able to eat anything at all, that could be something to help you. I mentioned avoid alcohol-based mouthwashes. You can use that saltwater mouth rinse for the mouth sores. That can help. And then definitely avoid the citrus. So this is something that oncology dietitians, we have on our oncology dietitian website, which you can go to. The link is at the bottom of this slide. But for those of us in the South, we're like, hey, look, it's like a nutritional, medicinal food here with okra. And some people don't like okra because of the slime. But the slime, it turns out, can be very soothing on somebody who has a sore throat or a sore mouth. And so you can use this recipe and get sort of a soup that can coat your throat and make it easier to swallow foods when you are having that pain, especially people who've gone through head and neck treatment with radiation to the neck. And your throat, it can be so painful for a lot of those people. They're on feeding tubes, but they're going to have to figure out how to eat it again afterwards. And so having something that coats their throat, that helps kind of slide things down, that makes it easier, is really helpful. So this is an option for that. It's a pound of okra. Now, you can buy okra frozen. So I don't have experience of making this with frozen okra, but I would think it would be an option. Is that you would use 4 quarts of water or some kind of broth if you want to. And then okra, and then if you want to make it a soup, you would add a grain. If you want to just make it sort of this soothing treatment that you swallow, you could just leave those out. So you boil it up, cut it as small as possible, and then strain out the okra. So that's kind of a really, it's interesting. People say it really helps. So nutritional signs to look for while you're undergoing cancer treatment, essentially what, I've already mentioned: weight loss, muscle weakness, less energy, easily fatigued, and then of course any labs you just want to keep an eye on. So if we can manage your symptoms, make sure that we're getting adequate nutrition, then that's going to improve your outcomes, which essentially makes your medical team happy and you happy. So then we're all happy. And those are our goals for nutrition during treatment. So this is sort of my conclusion, and we're right on time. First of all, that your treatment side effects vary depending on the type of cancer and the type of treatment. So when you're earlier stages of your treatment, it's not usually helpful to try to study ahead what you might have. What I would tell you is that there are tools you can pull out of the toolbox, recognize when something's not working, and intervene early. But you don't need to worry about all the things that might happen. Just focus on what you're dealing with when it comes. Number 2, remember our top 5 tips, which can help prevent and alleviate a lot of your side effects. So if I can remember them off the top of my head: avoid malnutrition, eat when you can, what you can when you can, fluids, grazing, so small meals frequently throughout the day, and number 5 is get your support team. And then always contact your treatment team if side effects get worse or unbearable. Do not wait on that. I don't care if it's nights or weekends. They give you an on-call number for a reason. Use it. And then remember, the recommendations to apply to treatment and nutrition differ for survivorship. So this is very much during treatment and maybe, in those phases after treatment where you're recovering. And then after that, we would focus on a healthy lifestyle and some of, what I spend a lot of time talking about in some of my other webinars. So that's the end of our sort of topic for today. If you have any questions, I encourage you to put them in the chat or the Q&A box, or you can always contact me afterwards. For sure, connect with me online. You can find these tips that we talked about at cancerdietitian.com/tips. I will have a webinar coming up. I think I told you on December 2nd, where I'm going to talk about some of the foods or products that can help meet nutritional needs during treatment. And then if you're interested in some of those survivor diet recommendations, you can go to cancerdietitian.com/webinar and find all of my other webinars, which includes these 2 coming up. So I do have a question that came in where somebody's asking about organic foods. So what we know at this point is that it's not necessary for you to only consume organic foods in order to get good nutrition. So what I often tell people, and I have a section on my website for hot topics, and organic is one of them. The amount of pesticides that are on your foods, whether they're grown organically or grown conventionally, is very small, because they have limits as to when they can apply the pesticides and how much they're allowed to apply. Organic foods, they do use pesticides. It's just a different type. So sometimes I think people aren't aware that there are residues also on organic foods. So what I say about that is, if it concerns you to the point where, you're kind of anxious about it and you can afford organic foods, that's great. But what the data shows is that it's not necessary, and that what's necessary is that you get adequate nutrition, whether it's organic or not, is not my biggest concern. But some people do prefer, like if they're going to get a nutrition supplement drink, they want an organic version. And I would tell you that's up to you. Have I heard anything about wheatgrass juice? So when I talk about getting nutrition, in food form is our primary preference. So first, we want you to meet your needs with food form. So that's to say that juice is not my favorite way for people to get nutrition. However, I think juices can be a great way to get nutrition if you can't tolerate food. So let's say that fiber is not something you can tolerate. And for some people, then juicing fruits or vegetables is a great way to get nutrients or get their sort of fruit and vegetable intake without the fiber, because they can't tolerate it. So wheatgrass juice would be fine. I wouldn't use it in place of food, and I would say I would limit it to, usually I say like 1 glass of juice a day is plenty. And then otherwise, I'd rather you ate vegetables. And then the other thing I'll say about, just getting juices is that I prefer smoothies over juicing. I don't know if you can actually put wheatgrass in a smoothie and have it taste good. So, I'm kind of mixed on that one. I would say it's not as big of an issue. If somebody is really not meeting their calorie needs, wheatgrass is not going to help touch that. So what I would say is I'd rather they filled their belly with a high calorie food than fill their belly with wheatgrass juice, which might have, a fair amount of vitamins, but is not going to meet any of their calorie or protein needs. So it really depends on the person. Good questions. Any other questions from people? Oops, I didn't mean to swap our slideshow there. What I will say is that you are welcome to contact me at any point by email. A lot of times, if you have very specific questions about your particular treatment, I'll probably pitch you to your treatment center dietitian, and that either will, I can help you find that, or a lot of times you just need to ask if one is available. You can also look at oncologynutrition.org, which is our national oncology dietitian website. There's information for consumers as well as for healthcare providers. And then the American Institute for Cancer Research is, of course, a great resource. That's aicr.org. And I'm trying to think, American Cancer Society does have some, nutrition information. And so those would be kind of the key places, as well as the National Cancer Institute, which is cancer.gov. So anyway, thank you all so much for joining me tonight. I hope that this has been helpful, and I will send out, once we have the recording and the resources all available on the website, you will get that by email. Thank you so much. Have a great night, and I will see you next time.